Data from the Ministry of Health indicates that about 40% of deaths in the country have been attributed to non-communicable diseases such as cancers, diabetes, kidney failure, stroke, and other heart diseases, as many people struggle to offer care and some families fall into poverty just trying to pay for treatment. In a bid to address the rising crisis, the Mahama-led NDC administration has rolled out the Ghana Medical Trust Fund, also known as the MahamaCares Initiative, to provide enough support to cover the cost of treatment for patients without enough support. Health Minister Kobna Minta-Akando says that the growing crisis from non-communicable diseases poses serious risks to public health and demands urgent attention.
Facility-based data from our 3 teaching hospitals show that the average annual treatment cost for NCDs is approximately 53,000 Ghana cedis per patient. This financial burden severely strains households, with over 60% of affected families facing catastrophic health expenditures. Furthermore, individuals diagnosed with chronic diseases have a 75% likelihood of falling into poverty within 5 years.
However, President John Dramani Mahama says persons battling chronic illnesses can now heave the sigh of relief, indicating that the Ghana Medical Trust Fund offers hope for patients without enough financial support.
Today we're launching more than just an initiative. We're launching hope. Hope for thousands of Ghanaians living with chronic diseases. Hope for families battling the overwhelming costs of care. Hope for a future where the quality of life is not determined by one's ability to pay for essential treatment necessary. The Ghana Medical Trust Fund will support specialist-level treatment for a range of chronic diseases, including cancers, diabetes, cardiovascular diseases, chronic kidney failure, stroke, and other complications. It will also progressively expand to cover convalescent care, palliative services, and home-based support.
The president, who pledged 6 months of his salary to the fund, disclosed that the fund needs around 3 billion Ghana cedis for the first 3 years and called on corporate institutions in the country to dedicate a portion of their annual CSR funds to support the fund.
This Ghana Medical Trust Fund program is coming to help are your clients who save their money in your banks. They are your clients who do business with you. And indeed, they are not only your clients, they are even your own staff. Some of your staff have died, from breast cancers and diabetes and all that. And so, as part of your CSR, if you give anything, you are giving it not just to help people, but to help your own clients and your customers and your own staff.
Meanwhile, the fund will be managed by an independent public trust with a board of trustees and a dedicated secretariat. It will use a national digital registry, a claims management system, and tools to assess who qualifies for support. Reporting for GHOne News, Abdul-Hanan Adam, UGMC, Accra.